Hey, it's Mercedes Stephenson, and this is the West Block, politics, perspectives, and players. This week, I sat down with former Chief of the Defence Staff, General Rick Hillier. He's been tasked with fronting Ontario's vaccine rollout. Here is the full interview with General Hillier. General Hillier, thank you so much for joining us.
Mercedes, my pleasure. Thank you.
Sir, you led a war effort against Al-Qaeda and the Taliban. Now, in a way, you're leading what people have called a war against this virus, COVID-19. What are the similarities and the differences when you talk about fighting an insurgency versus fighting this invisible enemy?
Well, I think number one is you've got to have a goal, and the goal is to beat that enemy, COVID-19, and to corner it down to at least a level where it no longer changes the entire life of every single person in Ontario, every single person in Canada, indeed the vast majority of the world. That's number one. Number two is you've got to make sure you synchronize, coordinate, bring together with leadership, with work, all hands. So all hands on deck to fight this enemy. And only by doing that, by bringing in the technicians, by bringing in the scientists and the medical professionals, but also the logisticians and the leaders and all of those folks together, no one person is as strong as a team. And so second part is you build the strongest team possible to fight the pandemic, to fight this war, to win this war. And that's what we're going to do in Ontario here. And thirdly is you go at it with full energy, full enthusiasm, but with your attack shaped by intelligence, shaped by information, and that's a constant gathering process. It's never perfect, but you work at it every single day. And the last thing I'd say is you go at it with full transparency. And the people of Ontario would know anything that I have to do as part of that task force in supporting the government of Ontario and the people of Ontario. I'm going to make sure it's transparent to as many people in Ontario as is possible. We're going to make sure they know what we're doing, what we're trying to do on their behalf, and why we are doing certain things. And hopefully we can show that to them that it's going to bring that benefit. So those four things are exactly what we did, quite frankly, when we deployed to Afghanistan, when we had Canadian sons and daughters at risk doing something for our nation 12,000 kilometers away from home on dirty, dusty, dangerous trails where people were trying to kill them. And we're going to try and replicate exactly the same thing here. We're not starting, though, from zero. There's been incredible work done. And those medical professionals in Ontario, world-class people, have been keeping us alive quite literally since this pandemic struck. We've got people in the government of Ontario, the civil service there that have been working hard to do certain things, and we're going to just try and build upon all of that.
What led to you taking this job on? Who asked you, and what made you willing to do it? Because you're certainly a very well-known Canadian leader, very well respected. We see a lot of folks after retirement pop up leading commissions. This is a very high-profile role, and I think the first really public one you've taken on since your retirement.
I think it is probably the first public role I've taken on, and I'm having regrets now. No, I'm not, actually. I was hiding out in Newfoundland last week, and the phone rang, and it was the Premier. I actually was tied up. My wife answered the phone, and he chatted with her, and she said, "General Hillier, my husband will phone you back." I've tried to get her to call me General, but she never does. And so I called him back, and he asked me to do the job. He said, "There's nothing more important for the people of Ontario," and I extrapolate or had to that and say, "There's nothing more important for the people of Canada," because as Ontario goes, so does so much of the rest of Canada. And he asked if I would take on running the task force and making sure that this mission is successful. I considered it for a while, and then I went back to him and said, yes, I'd do it. And the reason I said that was not because I was looking for a job, because I certainly was not. I'm enjoying life, it's very good, but duty calls. And you can't stand there and say, oh, I wish they did that, I wish somebody would do this, and be critical, if you will, and want things done. And then when the Premier of your province asks you, then you would say, no, I couldn't do that. Duty calls. I've stepped up, and I'm going to do my very best. I can't do any better than that. I'll do my best to make sure this is a success, and that we can be part of an awesome solution, and maybe turn the year of darkness 2020 into a year of light in 2021 for the people of Ontario, and again for the rest of Canada.
I think some folks wonder why someone wasn't asked to lead a vaccine rollout plan earlier than this. We're now in it. You're the guy who has to take command. In the military, you had full control over resources. You were the commander. You made the decisions. Do you have actual control of this rollout? Do you get to shape the plan? Can you commandeer whatever you need?
I believe yes. I believe yes. Others may disagree, but I don't think it'll be an issue. I think everybody in the government of Ontario the private sector in Ontario and the people of Ontario know that this is the most critical thing to all of us going forward here. And so people are going to line up to step in and bring their resources, bring themselves, bring their abilities to bear. The government of Ontario, the public service of Ontario, like I said, has already done such incredible work, and they're going to want this to succeed also. And I see no issue there whatsoever in having the necessary resources, the right kind of people, the smart, intelligent, educated people who are experienced at project management in many cases, coming on board to do this. I don't see an issue with it. Because we all want exactly the same thing. We want this to be successful. So I don't have an issue with the resources, the people, the budget, that kind of thing. Premier Ford said, I've got your back. Do what you have to do to make this successful. And that's what I intend on doing.
And I understand why that would be reassuring, but he said similar things about testing and contact tracing, and that hasn't come through. Does that concern you?
I'm not concerned about testing and contact tracing now at this moment. I'm concerned about this mission.
But if they didn't come through on that, are they going to come through on this?
We're going to make sure that we've got the right people, the right resources, the right focus, and the right support to do this. And I'm confident it's going to come from the Government of Ontario, and it'll come out of the private sector also, I know. I'm confident we're going to have the right resources to do it.
How quickly can you be ready? What's the earliest date you could do a rollout?
I don't have that date to give you. We haven't, I've had one briefing on actual work done to date here. I'm going to meet with a whole bunch of people in this next days and hours and days, frankly, and walk through our structure and what we want to do and who we want to do exactly what jobs. And like I say, a lot of this work has been done, so we'll do it fairly quickly. And we want to get ourselves as ready as possible, as quickly as possible. And so, we're going to aim to be ready quickly. And if we get more time, we're going to be even more efficient when a vaccine arrives. And that's, of course, is the unknown. We don't know when the vaccine will arrive, but we want to be ready. So we're going to hold ourselves to a really high standard here. I can't give you a specific date. But we're going to work hard to be ready.
Ballpark date?
I can't even give you a ballpark date at this point in time here. But something, the only thing I will say is the first day the vaccine arrives, we'll be ready.
Do you know how many vaccines you're going to be getting, that you're going to be responsible for rolling out? Because that would seem like a critical thing you need to know in order to make sure you have the right resources.
Well, I've heard the numbers, and I've heard the numbers that the Minister of Health talked about. I think the total was like 2.6 million vaccines between the 1st of January and the end of March. I'm not sure any longer, based on some of the conversations in public, of how accurate that is. I hope it is really, really accurate. And so therefore you'll probably have enough for 1.2 to 1.3 million people in Ontario to receive the double vaccine, because they have to get 2 vaccines over a 21-day period or so. And so that's what we'll be dealing with initially. And my belief is, if we can get up and running for that first vaccine and do that relatively smaller set of vaccinations, we'll be ready for the bigger numbers, which will roll after that easily.
What does the delivery of this vaccine look like? What's the logistics? Because I know it has to be kept very cold, I believe below -70. Are you taking it to hospitals and to long-term care homes and directly delivering it? Is there a central site that you're going to move people towards to administer it? Is it the military who's giving those shots?
I would say, except for that very last piece, all and any of the above. And that part I don't yet know. And that's why I'm going to have all those conversations and meetings over this next days here to resolve all of those great things. We do know we've got incredible infrastructure around Ontario. 34 health points, I believe it is, around Ontario with medical professionals. And this is not their first rodeo, right? They've done vaccines in the thousands and millions before. Every year, 5 million flu vaccines in Ontario, shingles vaccines, and I've had both of those vaccines, and pneumonia vaccines. So this is not their first rodeo. They know how to do a lot of this kind of stuff, and what we want to do is help them organize it. So the vaccine is ready, it shows up where it's needed, with the medical professionals who are prepared to administer it, with the prioritized people from Ontario who are going to receive it, and it all occurs seamlessly. I'll use the analogy of when we were building our house in Newfoundland. We had to order some hardwood floor from Montreal, and it was late arriving, threw everything off schedule. And when that was arriving, the contractor was right there, and he said, look, I don't want to see a piece of that board touch the ground, off the truck that came in from the mainland, onto my truck, into the house, and we're going to install it today. That's exactly what we want to do with the vaccine. When it starts arriving, we want to be there, take it right to the point where it's going to be administered by the medical professionals that we have in the thousands around Ontario, and they can administer it right away. We want to be that efficient. And so the longer we have to get ready, the more prepared we will be.
I think that
At
might be the first time Canadians
we don't
are.
want a long period of time. We want to be rushed because we want to see the vaccine arriving here, and we'll give it.
I think a lot of Canadians are concerned about that timeline. They'd like to see it accelerated. Is the fact that you've been appointed a sign to us that we should expect the military to be very heavily involved in this?
I don't think so. I don't know, but I don't think so. The Premier reached out and said, look, I understand what you learn and the experience you have in the military. And he said, you know, we've admired the military, and I personally have admired the military for a long time, how they can get things done. So I'm reaching out to you for many of those reasons. And so I don't think is linked to the fact that we'll expect the military to be involved. But the military obviously is planning, in case they are going to be involved, to support Canadians, which is what those incredible sons and daughters in uniforms do. And so having me as part of the Ontario solution to be able to work with the military in any aspect in which they are involved, I think that'd be a real plus. I mean, I do know something about the military. I haven't forgotten everything yet, and I think the connectivity would be very easy, and we can make sure that we work together seamlessly if they are utilized as part of that logistics effort.
If you don't yet know who, when, how, where, what are your benchmarks for success to make sure you're ready when that vaccine is in place?
We're setting those benchmarks now, and I'm not trying to avoid the questioning, but you know, I think you know I just spent 20 hours driving. I've had one briefing. I'm wrapping my mind around it, trying to build a small team of individuals that can handle those big muscle movements. We'll set the benchmarks. We'll lay out the organization, and we'll lay out the plan and get ready to do it. And no matter when a vaccine arrives, we're going to make sure we're ready. And we've got some weeks yet, obviously, because we don't expect anything before the month of January at the very, very earliest. And so we've got some time to do that, and that's what we're pushing on right now. We're not wasting any time here. We've got a lot of folks that are working long hours to put this together, and now I'm sort of off the road, off that driving, and I'm going to get stuck in.
Is COVID-19 a threat to our national security?
Oh my goodness, yes it is. It's a threat to Canada, and therefore it's a threat to our security. And you know, you talk about simple things like COVID-19 being that horrible, terrible threat to our economy. Without an economy, we can't be a country. Without an economy, you don't have the intelligence agencies and the armed forces and the police forces and the medical system, which secures and protects Canadians in every walk of life. Yes, it's a threat to our country. Not the security of it is actually, I think, a narrow part of it. It's a threat to the nation.
The government federally and governments provincially have spent huge amounts of money trying to combat this virus, trying to offset the effects on businesses who have suffered terribly. A lot of folks I talk to in uniform are worried that the Canadian Armed Forces is going to be a target for budget cuts after this. Historically, defense takes a cut because it's the biggest discretionary item in the budget. Are you worried there could be defense cuts after the pandemic?
I'd be lying if I said I weren't worried, because yeah, it's crossed my mind numerous times. I've had discussions with a few people outside of the military to talk about this. The word out of Ottawa, of course, always is no. You know, we're going to prosecute and we're going to finance the strategy that we've laid out for the Canadian Armed Forces. I hope that is the case, and I would push for that case, because without an armed forces that is healthy and stronger than it is now, quite frankly, we cannot have a healthy and strong country, and we can't find our rightful place in the world, which also turns around to make us healthier and stronger. And so I worry about it. Yes, I do. I hope that we don't look to the armed forces as an easy source of money to help balance our financial spreadsheet in the years to come.
The CDS announced his retirement in the midsummer. Chief of the Defence Staff, General Jonathan Vance. We are now at the end of November. We still don't have a new Chief of the Defence Staff. Is that delay dangerous when there's sort of a vacuum in leadership and we don't know what direction the Armed Forces is going to go into?
Well, you know, right at the middle of this stage of the pandemic, as we look to the arrival of vaccines, and let me just digress a little tiny bit, the vaccines are not going to give us the overall solution. As Yogi Berra once said, they're not the pancreas for everything that we have here. And so it's not the panacea. We're not going to have a solution just with the vaccines. We still got to wear our masks. We still got to social distance, stay away from me, stay away from everybody else, stay home unless you have to go out, and wash your hands a lot. And we still need really efficient testing and effective testing, maybe test at home and those kinds of things. And those three things combined will give us the ability to come back on this here. But right in the middle of that is the vaccine part, and that's a huge, huge mission for all of us. I'd hate to see the Chief of Defence Staff changed out in the middle of executing that mission.
So you think John Vance should stay on right now?
I think that changing the Chief of Defense Staff would be not a great thing for the nation at this point in time here. I think John is doing a good job, and I think John should stay on and carry out this mission and see it through to completion for all Canadians.
General Hillier, thank you so much for joining us and for your time today, especially after your 20-hour drive from Newfoundland.
Mercedes, my pleasure. Thank you.